Well, welcome back to Global Health TV. We're joined now by Patrick Watt. He's the Director of Development Policy at Save the Children. Patrick, thank you for joining us.
Thank you.
So Patrick, you've just released a brand new report. Please tell us about the findings.
Well, what we do in the report is we look at the progress towards the commitment that government's made for the year 2015 to reduce child mortality by 2/3 in developing countries. And we look at the progress that's been made across different income groups in developing countries. And what we find is that progress has been concentrated in most countries amongst better off groups. So we have seen progress towards the goals. We're not on track, but we've seen some significant advances made. The problem is that that's been accompanied by a widening in life chances between the richest and the poorest children.
And how surprising were these findings?
Well, it's confirmed some of what we suspected was the case, but this was the first time we'd looked at data across a whole number of countries. So there are 32 countries that we covered in this report that we've produced ahead of the summit that's happening later this month in New York. And what we wanted to do was to try and identify which countries were actually making progress with equity. That is to say, countries that were actually managing to improve the situation for the poorest as well as the richest children, and wanted to try and identify what the key policy lessons were in those countries.
So why is this happening? What do you think it tells us about what's happening with child mortality globally?
Well, I think one of the things that's happening is that countries in many countries are going after what we describe as the low-hanging fruit. They're rolling out interventions in healthcare, for example, that are benefiting better off populations, populations in urban areas, people who are able to pay for healthcare. And in many cases what we're seeing is the neglect and the bypassing of the poorest communities by official health policy. So some of it's about government spending, but some of it's also about some of those wider determinants of child survival. So nutrition is a hugely important factor in whether or not children reach their 5th birthday. We know that poorer households are less well nourished, and if we don't see remedial action to deal with that, then we're likely to see this widening of the gap.
Now, you're releasing this report just ahead of the UN summit on the Millennium Development Goals. Now, in the report you talk about trying to reduce child mortality by about 2/3, and currently it looks like we're quite off track with that goal. So what would you like to see happen when leaders meet in New York, and what kind of change would you like to see come about?
Well, I think what's important to recognise is that it's not too late to make real progress on these goals. There are countries, some very poor countries, Bangladesh, Malawi are examples, that are on track to reach this goal. So what we need to do is identify the lessons from those countries and ensure they're applied much more widely between now and 2015. The UN Secretary General Ban Ki-moon has put this global strategy for maternal and child health on the agenda at the summit. We want to see that strategy translated into a plan that actually accelerates progress at the country level. It needs additional resourcing behind it from both developing country governments and donors. We need to see the policy changes that will help to drive faster progress towards this goal. And I think if that happens come September, then between now and 2015 we can see a real step change in progress.
How relevant are the MDGs to the work that's going on globally to improve the lives of children?
Well, tackling child survival, you're right, is part of a wider challenge of reducing poverty, improving children's well-being. And we can't approach this goal, MDG 4, of reducing child mortality, in isolation from goals like education. We know maternal education is hugely important in terms of improving children's health. We can't approach it in isolation from the goal of reducing hunger. So the goals need to be approached as a package, but we do think that particular attention is needed, as you say, on these two goals of maternal and child mortality, where we've seen the least progress, and where without a real change of gear, we're going to see significant numbers of children continuing to die by 2015. Our concern is if the goal is missed by the year 2015, we're not just going to be looking at a statistical failure on the part of the international community, but also a moral failure.
Now, obviously, there's going to be a lot of publicity surrounding the summit. What would you like to see happen on the ground when the leaders have left New York?
Well, I think the important thing is that the countries that account for the majority of child deaths, and there's a relatively small number of countries, countries in South Asia, some of the high population African countries that, taken together, do account for a very large proportion of the children dying before their 5th birthday. Those countries need to be adopting clear national plans that identify what it is that's causing children to die before their 5th birthday, and that will vary from context to context. And then they need to be putting in place plans, funding them correctly, and regularly appraising progress between now and 2015. We need a really robust accountability framework at the country level, where civil society organisations like Save the Children and others are able to hold governments to account for their progress, are able to maintain the political pressure, One of the lessons from the countries that have made progress is that there has been consistent pressure from the publics in those countries to see this issue dealt with.
Now, obviously, globally, we're going through quite challenging times with the economy. What do you think this will mean in terms of progress for this Millennium Development Goal?
I mean, we are concerned that a number of donor countries have been stepping back from the commitments that they've made to provide overseas aid to address issues like health and education. We're hoping that there'll be a change of direction at the summit, and we've seen some encouraging signs. The G8 met earlier this year and they did make some new commitments to improving global health. We've seen African and Asian governments meeting subsequently and making similar commitments. So I think what we're seeing at the summit in New York is a moment of delivery. We've had the promises building up to this moment, and now we really need to see the money placed on the table.
Well, unfortunately, Patrick, that's all we have time for, but thank you very much for joining us on Global Health TV.
Thank you.